With Marla, I am going to be using the 1064 ND YAG, which we call the clear scan, on her left underarm. Before we start, we always use a thin layer of ultrasound gel, and this acts as a nice coupling agent between the skin and the sapphire plate. Just needs to be a thin layer. And now I will put the laser in ready mode. And this laser allows me to choose the size of the scan that I wish for the specific area. I'm going to place the sapphire on Marla's underarm here, and where the red LED pattern is where the laser will scan. And as you can see, it will scan in a non-sequential pattern very, very quickly. On the count of 3, 1, 2, 3. What you saw there in that brief, maybe 2 or 3 seconds, was that entire area scanned with laser energy. Now Marla, on a scale of 1 to 10, what would you say you felt? 1 being the least amount of pain, 10 being the most?
2 or 3.
So 2 or 3, not very painful for her. So I'm going to move the scan, the sapphire plate, and I'm going to cover her entire area, and you'll see how fast this is. Years ago, the older lasers might have taken us 10, 15 minutes to cover an area this size, and now, as you'll see, this is a matter of only a couple of minutes. Because of the effective cooling that we're able to apply to the skin simultaneously as we're applying the laser energy, the patients feel very little discomfort, as well as the fact that the laser is so fast, this helps with the discomfort as well. So I'm going to do one more scan in this area, and I can take my scanning pattern down. So here I'll go to a 3 by 3 square. You'll see how small I can get the scan here. This would be very useful for a very small area, especially around the nose or the lips. This is the amount of time it takes us to treat an entire underarm. As you can see, just a few minutes, not a lot of discomfort to our clients, very fast, very safe, and very effective. On Marla's right side, we're going to be demonstrating the second form of FDA-approved hair removal available on the Sciton Profile laser. This is called the BBL, or broadband light. BBL is a more advanced version of intense pulse light, which has been used for maybe 7 or 8 years in hair removal in the aesthetic industry. Now, before we do IPL or BBL treatments, we always use a thin layer of ultrasound gel to protect the skin and to provide a coupling agent between the sapphire and the skin. And we always wear protective eyewear, and Marla and I both have BBL glasses on. Okay, I've put the laser in ready mode, and I'm going to place the sapphire against Marla's underarm here using firm pressure, and on the count of 3, 1, 2, 3. Now Marla, on a scale of 1 to 10, 10 being the most uncomfortable, what would you rate that treatment?
2.
A 2. It's not a very uncomfortable treatment. The integrated cooling makes this more comfortable as well as the speed. Now I'm going to cover her entire underarm, and you'll see how quickly I'm able to complete this treatment. Here we go. Now I'll position my handpiece a little bit differently to get this ridge. Okay, I will put the laser in standby mode. And as you can see, I was able to cover the entire area in less than a minute. Very fast, very effective, with very little discomfort for our clients.